My name's Cassandra. I'm taking care of a patient who has cystic fibrosis. He's a 9-year-old male, and I will be doing my teaching for him on the importance of breathing and airway clearance techniques for patients with cystic fibrosis. I determined my need for teaching for this patient as he is non-compliant with his treatments outside the hospital, and he has been hospitalized previously for exacerbation of cystic fibrosis. So he's been treated for this before in the hospital. However, he was recently diagnosed. Therefore, he is not very knowledgeable about his diagnosis of cystic fibrosis. When I asked him what he knew about it, he was not really wanting to cooperate. He maybe just his age, he didn't want to really interact too much. However, I talked to him about teaching him about techniques to use so that he won't have to be coming to the hospital for these exacerbations, and he said that he did want to learn about these techniques. Therefore, I chose these techniques to teach him. So my main goal for the patient will be to learn different breathing exercises, airway clearance techniques, and the importance of these exercises. My objectives for this patient is that he will state 3 different breathing techniques. My second objective will be that the patient will state 2 reasons why airway clearance techniques are important. My third objective is that the patient will state how he will incorporate these exercises into his daily routine of just waking up and getting ready. He's a 9-year-old boy, so I'm sure all he wants to do is from the moment he wakes up is play video games. So maybe that could also be an incentive for learning these techniques, or also doing them. That way the mom can have some leverage over him. Hi, my name's Cassandra. I'm going to be your nurse for today.
Okay.
How are you?
Good.
You're feeling okay? No? You don't feel too good? Okay, so you have cystic fibrosis. So this is you've been in the hospital several times because of this, correct? Because you haven't been complying with everything. And it's probably because you don't understand what you have, right? This is a lifelong disease, and you're going to have to learn to live with it, okay? So I'm going to go ahead and teach you about some techniques you can use in your daily routines so that it can make it easier for you to breathe, okay? There are 3 different breathing techniques. There's one being the breathing control, which helps relax the airways. So you should breathe in through your nose and out through your mouth with a little bit of effort, okay? Using normal gentle breathing with a lower chest will help relax the upper chest and shoulders. And this is a good way to do this, to place one hand on your stomach as you breathe, so you remember to breathe gently, okay? So can you try it? Gently, okay? Yeah, that's good. Okay, and then the chest expansion exercises. You breathe in deeply, so you take a deep breath. And so some people like to use a 3-second count to hold in and get a little bit more air behind the mucus. Then you breathe out, forcing that air out. And this may be done with chest clapping or vibrations, followed by another cycle of breathing control. And then the third breathing technique is called huffing or huff coughing, okay? And this is also called forced expiration technique. But the huff cough is controlled lengths to move the mucus that you have in your airway up to the larger airways, so that when it's up here, instead of being down here in your lungs, you're able to cough it out. Okay? So those are the 3 breathing techniques. So can you go ahead and tell me what the 3 breathing techniques are? Do you remember them? You can look at those papers that I printed for you, because you can take those home for you. So what would be the 3 breathing techniques?
Breathing control and chest expansion,
exercises.
Okay, good job, Mom. Yeah, I mean, it's important that you also take part in his role. That way you're there to reinforce his teaching. Okay, so then that was 2. What was number 3?
Huffing or huff coughing.
Mm-hmm. Good job. Okay, so then now I'm going to teach you about the active cycle of breathing. Okay, so those are also different techniques. And I'm going to show you a YouTube video, okay?
ACTs are performed to loosen and move the thick, sticky mucus out of your airways so you can breathe better. All ACTs include huffing or coughing. Huffing means to breathe in slowly through your nose, hold the breath for 3 seconds, and then exhale with an open mouth, similar to fogging a mirror when you're finished. If you have questions about how to best clean your equipment, ask your CF Care team. When done consistently as part of your daily care plan, ACTs can help control infection and slow the progression of damage to your lungs.
I'm going to ask you what are 2 reasons why airway clearance techniques are important. So those are the ACTs, right?
Do you remember?
So
From the
you
video?
would get mucus out of your lungs.
Mm-hmm. Yeah, that's important, right? Because then you can't breathe. So can you tell me 2 of them? 2 of the airway clearance techniques?
Active cycle or breathing. This helps loosen
Mucus.
mucus.
Okay, and what's another one?
Chest therapy. Another person uses cupped hands to loosen mucus.
Yeah. This is your 3rd objective. How can you incorporate this into your daily routine? So say you wake up in the morning and you have your routine, right? You make your bed. And how do you think you can incorporate those into your daily routine so that you can get those in?
Do the cupped hands in the morning.
Yeah, but you can't do that on your own, so
I can help you with the cups
yeah. And what else?
before we go to bed.
Yeah.
We can do breathing exercises.
Good job. So that was my teaching on cystic fibrosis to my patient with cystic fibrosis. That was the importance of the breathing and airway clearance techniques. Thank you.